Oops. Alexa, dismiss. I need to turn my Alexa off.
No worries.
I
So,
mean, I'm going to turn her off.
oh, Alexa.
Hmm. Should be responding.
Oh, here comes some people popping in. We'll give it just a, another few minutes.
Yeah, no problem.
And this is all being recorded, so we'll send this out
Yeah,
afterwards as well. Um, oh,
There's always something that goes awry with technology, right?
always. There's going to be more things listening the older we get too.
Whew, mine's already started saying to me, "You're becoming a little bit technologically challenged." Thanks.
I hope my child takes away my ability to post things when I'm older. I hope she knows when it's
Tell
right
them
when the
now.
time comes, right? Like when the time comes, she'll know and she'll just do it. Looks like somebody's texting me. Let's make sure they can get in. Hmm.
Down. Good boy. Down. Yes.
Um, no, Edward, I cannot see you, but I see your name. Um, okay. Okay, cool. We will go ahead and get started. Thank you guys for being here. Just a very quick introduction. Sally and Matt are with We the People. They
We
are
the patients.
oh,
I'm
We the
sorry.
Patient, We the Patients. I know. It's like I love the whole We the People, We the Patients. That's, yeah, sorry.
Yeah.
Probably going to do that often. But with We the Patients, and they are all about fighting the insurance companies, navigating insurance, specifically, with rare cancer, rare disease, right? And just a tiny little bit of background. The way we all got here and the way this webinar came to fruition is Sally and I go way back. I'm from Statesville, North Carolina. Sally is from Statesville, North Carolina. I've known her family for years. I went to high school with her brother. Sally's got me by a couple years, but we both graduated from the same high school. And Sally had to navigate, the insurance world with a rare disease, and that's how Sally got involved. But I'm going to let Sally and Matt tell their story. Nobody gets into this stuff unless they have a story, and then
Right.
let them educate us. And then the second half, we'll jump into the Q&A. I've got some questions people sent me beforehand, and then you guys can also ask questions live in the Q&A part. So.
Absolutely. Thank you
Sure.
so much for having us. And, I hate that we have to have these conversations, but we truly need to because of the healthcare landscape. And like Amanda said, I'm Sally Nix, and I'm a patient first. Out of pure necessity, I ended up having to get what I like to call my master's degree in fighting denials. I had to learn so much about the system, and no patient who fights disease should have to do that. I live with multiple rare neurological diseases. So if I would start to slur, I don't have wine in my Stanley cup. And if I try to find some words sometimes and I can't, this time of night has me sometimes grabbing for words. But one of the things that happened with me is I became one of the original people who took to social media during my prior authorization and denial, and my story ended up going nationwide. At that time, I had a lot of other patients get in touch with me asking me how I did things, and I realized I had a voice. I am fully disabled and I do these things as a volunteer. But what is important to me is educating other people and having them understand the whys this is happening, your rights, where to go when something happens. And my superpower, holding these insurance companies accountable, because that's the one thing that we all have to do as patients is hold them accountable. So that's what brings us here today. I've learned a lot out of necessity. Matt has taught me a lot. And so I'm going to let him tell you all that he does and how
Sure.
well we have been able to work together and what we're doing together.
Thank you, Sally. Yes, my name is Matt Toresco. As it says, I'm a rare disease strategist. I ultimately work with pharma and biotech companies and, any payer if they'd like to get involved in patient advocacy and elevating the patient voice. I'm not going to hold my breath on that one, but really my work is devoted to ensuring that we can all share our voices and that there's folks willing to listen. I'm the founder of the Empowered Patient Foundation, and as you heard earlier, Sally and I both are co-founders of the We the Patients. And to give you some context, We the Patients is focused on the legislative change. How can we enact bills at the state and federal level to ensure that we don't have to fight like this? Whereas the Empowered Patient Foundation is focused on ensuring that we can empower you for today through education. Because at the end of the day, as Sally referenced, she had to give herself this PhD in kicking insurance companies' asses, and she does it quite well. But we don't expect everyone to get at that level. You shouldn't have to hold them accountable in a social media perspective, but sometimes you do. And tonight is really ensuring that we can show you where the line is, what the ground rules are as well, but more importantly, what are your rights? And give you some practical application of that. I got into the patient advocacy world after breaking my neck in 2005. And luckily for me, after 18 years of chronic pain and nothing but opiates, was able to find my way out of that and get the surgery I finally needed with the right surgeon to get out of pain. But I've been in the healthcare space for over 20 years, and it still took me 18 years of those fights. So I'm happy to be here tonight with you all. And Sally and I are excited to not only introduce you to different ways that you can fight back, but also be available to you afterwards as well.
Absolutely. And I'm going to add to this. You're going to hear a lot of language. We're going to work our best to explain what the terms mean, from prior authorization to retroactive denials. And my new favorite thing is called the ghost approval, your appeals, the deadline. So we've put together something that is very useful for you. And so we'll start digging into it.
Yeah. So ultimately, we know you cannot control the diagnosis. We know that there is let's face it, there's an emotional period that takes place after your diagnosis, and everyone wants to move fast, and perhaps you also want to move fast, but the insurance companies, their goal is not to move fast, right? We know that every hour that is spent on hold or an hour spent not in treatment is an hour away from you, and the time that it takes for you to fight as well, it's a heavy burden to tackle. But ultimately, in this economy that we have in the US known as healthcare, nobody sees the patient as the actual end customer. They're all working for each other. They're all working to try to maximize their bottom line, because that's the common language we hear from insurance executives is always, we're not doing anything wrong. We're doing our job. I'm sure we can all agree that they can definitely do a better job of serving their customers, but their job is to their bottom line. Their job is to their shareholders, not so much we as the patients. So as we look towards a legislative fix for that, we want to make sure that you can control the controllables, and we always want to make sure that we start with the paper trail. Right, Sally?
Absolutely, absolutely, because the paper trail can make or break what's happening with you right now. I brought something out just to prove the point. This was my paper trail with my IVIG fight when I first had to start fighting for the care that I desperately needed. We didn't hear a lot about the denials. We didn't hear a lot about this file right here until the fateful day that Luigi Mangione murdered Brian Thompson. And then the next thing you know, prior authorization is blowing up. You're hearing all these stories, horror stories of people being denied, and everybody just has no idea what to do. So I want to make sure, since I've had 5 brain surgeries, I have notes that I want to make sure that we follow. So
Yeah.
the paper trail itself is all about knowledge, because that is your leverage. And you won't believe some of the things that you are able to find out if you also ask the right questions, correct?
Correct. Yep.
And
And you have rights. You have rights in all of this to even before we go down that route of the paper trail. I think it's important that everyone knows that you have the right to know, right? You have the
yes,
right to a written denial, as Sally will talk about with this paper trail. You have the right to a reason for that denial, the criteria that was used by the reviewer to come
mhm,
to that denial, the individual who reviewed the criteria to make the claim for your case. And we know that a lot of these are rubber stamps, so to speak, or AI systems nowadays, even being utilized. A couple of payers most recently have been flagged for denying claims at less than 2 seconds per claim, which is not humanly possible, right? But your first right is your right to know. But you also have the right to an appeal, right? You have the right to not only an internal appeal, but an external appeal as well. And Sally, why don't you fill folks in on that external appeal?
absolutely. And I'm going to say one thing too.
Mm-hmm.
The paper trail and getting what you need is an entirely different kind of barrier, because they're oftentimes that these insurance companies do not want to give you what you're asking for.
Yep.
And that's where you have to make absolute notes. You have to ask them why. You have to ask them how. You have to ask them what is the policy you are using to deny this care. The questions that I have been able to ask about those particular crucial parts of my whole treatment and the denials, my my denial right now is being upheld on a completely different policy. It is a misaligned policy that I've had to learn about, had to document. So I've gotten into like Medscape, I've gotten into all kinds of other medical journals to be able to turn back to this company and say, here are the things that I have learned through my research, through the paper trail, and how I have arrived at it's not just proving that you need care, it's also getting the insurance companies to prove to you why they are denying it.
That's right.
So asking some of the right questions is what really can help you. I led my insurer to a couple of things about this policy. One, I asked them specifically how they were denying this care. They gave me the policy. I saw that it was misaligned, but I also asked them how they update the policies. They went back and gave me the criteria of where they go. The information that they shared with me at that point in time was something that became very valuable to me. And this is why asking these questions matters, because they told me they consult with CMS, which oversees its Medicare and Medicaid. Well, I'm a secondary insurance holder of Medicare because of my disability, and I was able to go into the CMS system and prove that the care they were denying is actually approved with CMS.
Yeah.
So they can't use criteria to deny care when you can prove that that same criteria allows the care.
That's right.
So as you're doing your paperwork, you need screenshots of your portals as you see information change, because I've watched mine change within a week to be able to prove something that happened. You have to ask everything, not just a phone call. You have to ask for them to put every single thing in writing. You have to get your explanation of benefits, whether you get them online, whether you get them in the mail, and you need to go over them and find out what they're denying, why they're denying it. You've got to know your own diagnosis codes, which is unfortunate. We as patients should know these codes. You have to know your own treatment codes. So therefore, you can search and find out if they're denying one treatment and approving another one, you know which ones to argue. With my IVIG, they were denying one brand, but they were
Mm.
approving another brand. And that was so interesting to me because I compared it to toilet paper and toothpaste. I know that sounds so simplistic, but it's Charmin over Northern, Crest over Colgate. Why would you approve this brand of the exact same drug? So you have to document all of this. You have to, every denial that you get, you say, you go through the reasons why. And if it's not good enough, you get back in touch and say why. So the papers and everything that you keep on hand go towards your fight later. And what becomes more important at that point in time is you begin to be able to see all the information you have and the information that you still need. And we'll talk about that in a minute and how to get the information
Yeah,
that you still need.
that's right. And just a couple of things here. So keep in mind, these are all your rights. So an approval or a denial is a legal opportunity. And the more you can ensure that when you are on the phone with these folks, that they understand that this is a potential legal proceeding waiting to happen, the better off you will be as a patient. We're not threatening lawsuits, but ensuring that you get the name of the individual you're speaking with, and if they are a medical director, their NPI number, which is their national provider ID, that is their license number. That ensures that you not only have it for your records, but it changes the air of the conversation quite a bit when you're asking for that information. In fact, I have heard of some payers refusing to give their MPI
Yes.
at this point. Again, that is supposed to be on and in the record. Okay. And then lastly, as Sally referenced here, you have a right to your full claim file. And Sally, you
Yes.
can do this better justice than I can
Yeah.
because, the claim file is not an EOB. It's more than that, right?
Yes, yes. And as Matt said, with the external review, you go through your denials, your appeal, but you have a right to that external review. And what to reference what Matt was talking about with the MPI number and the physicians reviewing your care. In my case, I had a retired OBGYN who could not even pronounce my neurological disease, denying my care. Right now, I have a family medicine doctor denying my neurological care, that
Mm-hmm.
my neurosurgeon, my neurologist, my interventional pain specialist, a family medicine doctor cannot speak to that. So an external reviewer has to be the exact same specialist, has to be able to speak to the disease, and is an outside company. It is not like the peer-to-peer review that you hear so much of, because the peer-to-peer reviews are neither a peer nor a review, because there are laws right now that are or bills, I should say, working to get passed into law where they are requiring that the insurance companies make that reviewer the exact same specialist as your treating physician. So as you're going through with these rights and getting all this information, you can ask for something called your claim file. I
Mm-hmm.
did not know what that was until I was doing a deep dive and found an article about a gentleman by the name of Christopher McNaughton. Christopher had one of the most severe cases of ulcerative colitis, and he was being denied care left and right and could not figure out what was going on. And he learned that you could ask for every documentation internally, meaning the medical director and the CEO going back and forth about something. You have a right to that. You have a right to your call log. You have a right to recordings, both internal and external. And he asked for all of this, got bits and pieces, which is exactly why this becomes a huge insurance barrier, because the insurers have information in there they really truly don't want you to have, like what might have been said behind closed doors. And the claim file gives you an interesting look in the behind the scenes. So what McNaughton found was they were actually talking about him laughing about how they were denying his care, how they flagged him as a high cost patient, and why they were using that to deny care. They also had the physician saying, oh, I just look at these, talking to the internal nurse going over the appeal. I just look at these and just sign it and push it on because.
I have to just say one thing very quickly, and I am so sorry, but I asked for my call recordings from Blue Cross Blue Shield of North Carolina, and I know I'm so out of step here, but I can't ask questions in the Q&A. I want to, but I can't because I'm not able because I'm a panelist.
Mm.
Darn it. But I asked for them and they literally told David and I like no, like at first they said, "Oh yes, we'll get them for you." And then they came back and they said, "No, we will not."
Well, I will
Which means there's
explain to
probably
you.
something in them.
Yes.
Okay, so just okay, now I'll stop and like that's a
Oh,
Q and
that's a
A
great
question.
question.
Well,
No,
yeah,
it's a
we'll get
great
back to
question.
that. We'll get back to that.
And Larry, we'll come to you too.
It's a
Yes,
fabulous
yes, Larry. I saw
question.
your question, and that's another good question. Oh, I've got so many good questions, but I'm not
Well,
gonna.
here's the thing about the claim file, and this is, you brought up a really good point. I asked for my claim file with my IVIG. I'm going through the same thing again with this recent denial. What I got from my claim file was all the information I sent to them, were all the letters, because I will say one thing about me is I go through the proper channels, but I also go to the CEO, the medical director, the legal team, the vice presidents. And if you are fighting something and you need to know how to get in touch with those CEOs, you come to me, because Matt will tell you I'm a find outologist. I will get
Yep.
their emails. I will get a way for you to contact them. And I go through the proper channels, but I go to them.
How did we never work together? Because the only reason I got to where I got with Blue Cross is reaching out to the CEO. I got his cell phone number and I called him. He didn't
Mhm.
answer. I sent him a text, and like within 2 minutes, I had someone reaching out to me telling me that I because I'm a special because we had rare cancer that we
Mm.
now have a concierge.
Oh
We
yes,
have a
they
concierge.
that's a famous trick. That's
Oh
a
well,
famous trick.
they got us. And
You you
this poor woman, I
oh
was so
yeah.
thankful not to be talking to people that I couldn't understand and couldn't understand me, that I was just like, this is it. This is the person.
Yes. That's
Okay.
a way to satisfy you. That's a way to give you, and they have these escalation specialists is what they are. So when you ask for the claim file, and I got the emails back that I sent to the CEOs, I got all of the things that I sent them, I got the policy that I knew backwards and forwards already. And I looked and I got nothing that I asked for. And I will definitely share the link where you have like a form letter to ask for your claim file. And I sent them another one. Thank you so much for this information that I already had. I need this.
And by law, I'm entitled to.
Exactly. And I started citing the law.
I
So,
kind of feel like that is like someone who uses, someone that might have a lot of money that uses lawsuits just to,
Hmm.
shut people down because they have so much money and no one else does. So eventually they just give up. Like that's what insurance companies
mhm.
are doing with
That's
our
exactly what they
time,
do.
with our
Yes.
time.
Well, insurance
Yes.
companies now and all of this has become a negotiation. That's all it is now. You're negotiating, and Matt alluded to something earlier about how they do their business practices. There now the big thing is, and Matt and I have talked with someone extremely knowledgeable who knows this inside out, who has said, "Oh no, we are not denying your care. We're denying to pay for it. You can go have the care." But like for me and for you with rare disease, my
Doesn't work.
my bill for July for just sitting down in the infusion chair was $54,000. So of
Yeah.
course I'm not going to get the treatment that they're denying. But you brought up a very important point, Amanda, is you have the right, as Matt said. So I guess, I like an organic conversation, and these questions are excellent. And I think it's a perfect way to talk about your rights and how you go to complain and what
Hmm.
regulators you go to when you're being refused care. And it depends on the type of insurance that you have. So I'm not talking about Cigna, United Healthcare, Blue Cross. I'm talking about, do you get your insurance through an employer, your husband's employer, and they're a self-funded employer, meaning that the employer actually is a third-party administrator.
And then what if
Excuse me. They use the insurance company as the third-party administrator, and the employer actually writes the check. But the CEOs of these companies, they don't know what's being denied. They don't know why things are being denied. They're just paying. That's the cost of doing business.
Yep.
So you have to know that the self-funded employers like that, you go to the United States Department of Labor and make a complaint because there's ERISA rights, and I want to make sure it's Employee Retirement Income Security Act. That's what ERISA is. It's the law, but it's managed by the Employee Benefit Security Administration under the Department of Labor. So we're going to get back to that in 1 second. The
Yep.
fully
I was
insured,
gonna say that we have about 4 minutes until we're half done.
okay,
So
Okay.
this is a perfect spot, actually.
well,
We're
but I just don't want to. I mean, I want all this information from you, Sally and Matt, but I also want to make sure we get the questions done. So you saw the
absolutely,
ones that
Yep.
we've already. I sent you the pre-asked questions, and
yes.
gosh,
Yep.
I probably got 10 questions myself, but I'll keep mine. I'll just call you Sally for mine.
Sure.
All
The fully insured is like a company with 10, 50 people, and they actually the insurance, they pay the insurance companies, and the insurance companies have the risk. And then you have like the ACA and the individual marketplace. And so the fully insured and the ACA, they go through like your state Department of Insurance. And then you have things like Medicare, Medicaid, and they go through CMS, which is Medicare, Medicaid. And sometimes with Medicaid, you have to go through the state agency too. So when you're in that situation and you're not getting your claim file, I filed a complaint with the Department of Labor. I gave them all kinds of information. They saw that my ERISA rights were being violated. They went to the insurance company and told them that. But here's where the legality comes in. I got letters and everything from the attorneys of my employer, my husband's employer. I was threatened because even though they can say your ERISA rights are being violated, they can really not do anything about it. And that's where lawsuits come into play, and you don't want
Yep.
to get into all of that. Matt, what do you have to add?
Yeah, I would just a couple of things. So, with regards to the Department of Labor, they are not a judicial body, so that's
Right.
why they can't bring any lawsuit. They can claim that there is a problem here, that your rights are being infringed upon, but it's upon you or the employer to bring the case against the insurance company. Not a good fight. In fact, the insurance companies would relish that fight, because they'll just pass the blame to the large employer to say, we're just doing what they want us to do, right? We're managing the benefit. In that world, in the insurance world, you have to understand about 5% of patients spend 50% of the money
Mhm.
in the insurance world. They are doing everything they can to try to minimize the spend of that 5%, because that is where the profit is made for them. So these barriers that you are feeling, as Larry's put up here, when do I find the time to file an appeal? Well, that
Mhm.
appeal should be done by your provider. You might have to let your provider know that you'd like that to be appealed. Unfortunately, these days, I can't remember what the last data I saw, but I know for the ACA plans, it was 99% of denials were not
It
being
is.
appealed, right?
Yes.
Because the physicians are burned out,
Mhm.
right? They're seeing patient after patient after patient. That is not an excuse.
No.
If you've gotten a denial and you know that you had the discussion with your provider that this is the right treatment for you, then it's up to your provider to file that appeal.
But they are
You
also
can,
spending 18 hours a week
yes, minimum.
doing just this minimum.
Yes, 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 yes. So I'm
Yep.
gonna pull you guys in for just a minute because you guys, y'all are so passionate, and I am so excited that you're so passionate because I am too. I'm so fired up now. I just I wish I had time to do exactly what
Yeah.
you're doing. But I have to cure appendix cancer.
Yes.
Just a small
Like,
feat.
I mean, I have to try to get somebody to cure it because I'm not qualified, but I need to do. Yeah, so I would like to get to the Q&A, and I would like to
Hmm.
say what you just said really resonated with me back in a long time ago in my much younger years when I lived in Raleigh, North Carolina. I had a CEO who was like a tech guy who said, "I'm leaving this tech world and I'm gonna go open. I'm gonna buy this old church and I'm gonna turn it into a hospital that cares for all these people, and it's still operating today in Wake County, um, and and um, and it's a really cool place because you can go and you can get treated and you don't have insurance and you pay zero or
Yeah.
dollars, and so the way I was able to recruit, because he asked me, because in the tech world he used me as a recruiter, so like I was I recruited people, Sally.
Yeah.
Mhm.
and
Sure.
and so he wanted me to recruit physicians, but he only wanted to pay them like 150,000 a year, which seems like a lot of money to a lot of people. However, not to physicians. But the reason I was able to attract people to that position is because they had no paperwork.
They didn't have
No
to file
paperwork.
No
insurance.
paperwork. They just
Yep.
wanted to help people. They just wanted to
Yep.
help people. They didn't want to have to deal with all that because that's what they do spend most of their time doing. And so now
Hmm.
I will stop, and I just wanted to share that story because it was so relevant.
Yeah.
But we as
But
patients we are experts in our disease.
Yeah.
We have to know everything there is that we could
Yeah,
possibly
but there's
soak
there's
up.
a huge there's a huge disparity in that. Like some people are really good
Sure.
at understanding that stuff, and some people aren't. For the first 6 months, I could not understand
Well, you shouldn't
anything.
have to. That's the problem. You shouldn't have to. And that's why we're having these discussions. That's why we're talking today. But you
Well,
were
there are people to help.
yeah,
I
you
I do
asked.
though want to start with the questions just in case we get a
Yeah.
bunch because
Do you
I
mind if I get to Larry's? Do you
well
mind
I
if I
was
get to
gonna yeah
Larry's just to
but
finish
I'm
that
gonna
out?
yes but I'm gonna read it out loud so that I
Sure.
because nobody else will know what the question is if I don't read
Sure.
it.
Yep.
So Larry Stevens, how do you find the time to file an appeal? Number one. I love this question. Um, Also, because I did file an appeal. Also, the kind of appendix cancer is goblet, same as David. And this was not us, by the way. It's actually classified as colon cancer.
Oh
So
yeah.
if in this, I think that he asked this right around the time that you guys said something about the codes, like
Mhm.
the
Hmm.
codes of your treatment and the codes of your disease. And I was thinking to myself, I wonder how many hospitals have appendix cancer codes. So anyway, let me continue. So if I need an appendix cancer specialist, and I'm in an area that doesn't have a like a drivable to appendix cancer specialist. Well,
Yep.
what do I do? And what do I do if I can't afford to actually travel to a specialist? So
So there, a great website to give you first and foremost would be findhelp.org.
Mhm.
So that is a easy ways to think about it is what are all the state, federal, and local programs that are available to anyone for anything
yeah, but
from
those
legal
things
assistance.
really just I think they suck because like I've sent people all over the place on those things and I haven't found a good one
uh,
yet. So
for I'm sorry, the
no,
aggregator.
yeah, no, for like funding travel, like helping
So
people.
Okay.
that's the
Okay.
thing. Go
Yeah.
ahead, Sally.
That's That's a very difficult thing for a lot of patients. I was going back and forth to Johns Hopkins, and you have to, like Matt said, this is where we have to dig deep as patients sometimes, and to find help has resources. There's sometimes housing, other things like that. But one of the things that Larry,
Transportation is one.
yeah, transportation, that's another barrier. But like Larry asked about the colon cancer and the criteria. And that's the thing, the outdated criteria that they have for these rare cancers, when you can't find all the medical literature because it is rare,
Yeah.
they deny things based on the wrong criteria. And that is again where your provider really has to go to bat for you. But he mentioned an organization. I'm going to mention another one that I know Matt has in his back pocket, is getclaimable.com.
Mm-hmm.
And Claimable is a company that Dr. Warris Bokhari created to do nothing but fight denials. And he has been in the rare cancer space for quite a while now. And he is getting a lot of these denials overturned. He's getting
Mm-hmm.
things overturned before they even get to the appeal stage,
Hmm.
because being a physician, and he also has people all over the United States, and he has a reach. So there are organizations like that that are very adept and are very qualified and excellent in fighting the exact things that you're saying.
Yep. And I would just add to that when it comes to that appeal, perhaps escalating it to a peer-to-peer would be a major benefit from the perspective of you're dealing with a rare cancer that does not have the right code in the first place. That needs to be discussed between the medical director and your clinician, right? So getting them on the phone
Yeah.
one-on-one
This
is one of the most beneficials. What are you saying? What do you got, Amanda?
Well, what I'm gonna say is like, like people are like, oh, Amanda, she's running Appendicure, but like I didn't know this stuff. And so I
Mm-hmm.
was just blindly navigating it, and I had no idea there were codes. Like
Right.
I didn't realize until I got super mad and then started researching that, like, if you go on Blue Cross Blue Shield North Carolina's website, you can't find a specialist for appendix cancer.
You
There
can't.
No.
there's not one there. And so
And that's why
Yeah.
people like Warris can really help you. But there are other resources. My own Substack, I educate every bit of what I'm talking about: the claim file, the codes, what you need to know. And Matt does the same thing with the
Mm-hmm.
empowered patient. There are questions that you can go and ask in his whole database, and it can tell you, well, go to this place for
Mm-hmm.
XYZ. Correct, Matt?
Correct. Yeah, correct. And the big thing here is how can we remove as much of this as possible from your plate?
Right.
Because you need to get healthy, right? So if you're falling into that place, Larry, where you don't have the time to file an appeal, I highly recommend getting in touch with Claimable from that perspective. If you don't feel that your physician is capable of doing so, but at the same time, if you don't feel like that physician is able to treat your cancer because they don't have the expertise, look into those options in finding in either maybe a support program that can get you that flight to a specialist to travel there. That's one of the things that I had to do to get my surgery in
Mhm.
Manhattan, was to help find support to travel and stay in the Manhattan area. But they're out there. There are plenty. And one of the things that I'll continue to come back to is that find help includes not just the national ones, but the local ones as well. There are organizations in your backyard that you may not even know have funds specifically for transportation.
Yes. And also see if you can't get in touch with an oncology nurse navigator who
Mm-hmm.
who has and there's an organization called AON, the Association of Oncology Nurse Navigators. Get in touch with a nurse navigator, because somewhere in the United States there is a nurse navigator who might have a lot more knowledge about appendix cancer than you realize. So
Yeah.
resources like that are very important.
Yeah, I would actually really agree with that. And the only way you know is if you run down that road. In
And
fact,
you have
Sure.
to. It's a lot of
and you
work.
run down a lot of dead ends too, but
Sure.
you know it's kind of like a numbers game, unfortunately. And 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 you know you guys are doing the work to try to help everyone navigate it faster than you had to navigate it, and
Sure.
God knows
Yes.
faster than I've navigated it.
Because I'm writing
So,
thesis with
yeah.
footnotes demanding my expedited external review, which by the way was denied. I was told I didn't qualify for it. So I've once again filed a complaint with the Department of Labor
I can't
because
believe they're still messing with you, Sally,
Yeah.
honestly. So
they're doing
I
it.
just want
Me
to say
too.
one thing before I go into
It's
all the questions.
retaliation.
I just have to say one thing before we go into the questions. The reason, so Sally and I have kind of been talking about this for a year and a half or so, just kind of back and forth. And then she ran off and got busy, and I ran off and got busy, and then we would come back together. But the last time we came back together, she posted something that I could not stop thinking about. She actually billed her hours, the hours that she spent working on her and all of this, all of the insurance stuff. She actually billed her hours to Blue Cross Blue Shield. I think it was Blue Cross, right?
It was Blue Cross. I invoiced them and it was done tongue in cheek. And
Yeah, yeah. You weren't actually expecting to get paid,
no,
right? Yeah.
but the
No.
conversation that happened around that with providers, with other patients, with organizations, through the article, my gosh, over 200,000 people. It went viral. I'm finding it popping up in places all over. But what that did was really prove a point, and exactly what Larry
I think
was talking about. Who has the time to do that?
no. I mean, no, I literally just in one day, I sat on the phone and I was in Houston, Texas too, in a hotel that I was paying for, to go see a specialist that Blue Cross had
Hmm.
said they would pay for, but then decided out of the blue that they weren't paying for. But on the phone, sitting there with COVID too, by the way, we got COVID
Oh,
while we were there at MD Anderson, but like literally 6 hours with someone who really had no idea what I was saying. I couldn't
Mm,
understand what he was saying. It was so those are hours I will never, never get back.
never get back.
Ever get back. And you build them and you did it and they paid you. I mean, Sally, that's all I can say is like,
you have to be very careful with some things like that because they can look at it the wrong way. And you have to understand this system is built this way.
yeah.
It is built this way. It is built to deny care
Not
first.
broken.
It is not broken. It was designed this way. It is built so you will give up and just say, oh, okay, so I can't get these injections that I desperately need. I'm going to have to go have a sixth brain surgery.
Hmm.
These are the things that they put in front of patients with rare disease.
Yeah.
Our
Yeah.
decline in health happens.
Yeah.
So what are some of the other questions that we can
Yeah,
get to about
let me jump into those real quick. My surgeon says cytoreductive surgery (CRS) with HIPEC, that is the chemo, the hot
Yep.
chemo, is his or her only real shot at long-term survival. But my insurer keeps calling it experimental and investigational, which is crazy to me because Audrey Hepburn had this in 1993. How can it be
Hmm.
that anyway? So how do I fight a denial when the insurance company's own policy hasn't caught up with what specialists consider standard care?
Matt can tell you all about that.
Yeah, so this really, the only
Unbelievable
way that
though.
you'll have success, yeah, the only way that you're going to have success here is through that peer-to-peer process. When your clinician is willing to get on the phone, and again, that what's your NPI, what's I'll share with you mine, because what you're trying to really showcase, as Sally has said, these folks that are denying your care have never treated a patient with appendix cancer.
Mhm.
They've probably never been in oncology. Okay. So once they're able to ascertain what that particular medical director's specialty is, they are able to do their magic. The key here is, has the peer-to-peer been set up? This is where you as the patient can have the most impact, because I was having surgery on Monday. On Friday, care was not covered. I got on the phone, called the physician's office. What's going on with surgery? It said my insurance says it's not covered. Oh, we're waiting to hear back from them. I call the insurance company. Doc wants to have a peer-to-peer. I want a peer-to-peer to be scheduled. Can we get one scheduled? Yeah, we'll call them. Okay. You call the doctor's office. And I went back and forth for about 6 calls to each until that peer-to-peer was scheduled. And 20 minutes later, approval was had.
But I'm going to also add one thing to that. That doesn't necessarily mean that's going to be the case, because my peer-to-peer was denied. And they did not give my physician time to get on the call. So it was neither a peer nor a review.
What do you mean they didn't give him time? They just said, oh,
his office.
He's got to be on at a scheduled time.
Yep.
It's a scheduled time to make that phone call. And if you miss that window, they consider it a denied attempt.
Well, he wasn't even missing the window. They let him know on Thursday afternoon their office is closed on Friday.
Huh. Yeah. Well,
and he didn't even know it.
That is set up for success.
Exactly. And he did not even know that. But even if the physicians are on there and everything works out in Matt's case, let's say it didn't, and that peer reviewer who denies the care, that's when, okay, then I'm going to an external reviewer. And because appendix cancer is so rare and no one should die on hold, that is one of the things we say all the time. Nobody should die on hold. Because it's so rare, because of the mortality rate, you can demand an expedited external review, meaning it has to get done in 72 hours.
And that's something insurers have to, if you have
it is legally binding.
They have to do it.
It is legally binding, but they will still try.
But what happens if they don't? And how can you make them?
Well, I went through the expedited external review.
Yeah.
It was overturned. So I was able to get my treatment. It is legally binding. Blue Cross has to do it, has to continue to do it as long as I need the care and as long as I'm with them. But here's the thing, they can still find barriers to care with this. This year, they threw a cite review with me, meaning they wanted it to be administered somewhere much cheaper than the hospital. Well, I have rare disease, I have allergic reactions, I have something called autoimmune hypersensitivity. There was no way that I was going to be able to be out of the hospital setting. So I went to war once again with them, proving that the cite review had to happen. Emailed the CEO, emailed the medical director, did all of this stuff. It finally was approved that it can be done at the hospital in the infusion room. So there's so many hurdles we have to jump through. It doesn't matter whether it's complex neurological disease, rare cancer, breast cancer, or cardiac disease. They are going to put every stop your way. It's become our burden of proof that we need this medically necessary care. And when they deny it, saying it's not medically necessary, again, that's where you have to find the journal articles. That's where you have to get your provider to submit all of that.
I have, for anybody who is listening to this, I have all the journals. I have all the documents.
Great.
I have everything you need. Just come to me, because I can just send it to you so fast.
And this is important. This is very important to share things like this as patients. I shared my entire IVIG file with another patient who's been fighting IVIG, and her story's gone national. Yeah. So we have to, as patients, this is where we have to band together. And
I've got basically literally a global, I mean, so many people that have told me what has happened to them, and first of all, the misdiagnoses, the insurance debacles, the bouncing around with different diagnoses. Like
Right.
Mm.
it's like one thing after another. Like, so I feel like, I don't know, do you focus on one thing, just the insurance, just the diagnosis, just the lack
Well,
of testing, just the lack of treatments? I don't know, but like we have more questions and we have 12 minutes.
yeah,
But Matt's going to say
go
something. I
ahead.
know exactly
Oh,
where Matt's
oh,
going
sorry.
with this
I,
too, probably. Your voice
oh, no.
matters. Your voice matters.
Yes.
And the way we change things is uniting together. And that's where we, the patients, comes in. Because Matt, we have this amazing patient poll that talks
Hmm.
about all of this. And then this data, that's your voice in this data, is where we go and drive this legislative change. So these barriers are dropped. Laws are put in
Yeah.
place to where this does not have to happen. So definitely go to wethepatients.org, and that national poll is the only thing you're going to find right there. Take that
Oh,
poll,
can you
share
put
your
it? Well,
voice.
I was gonna say, like let me send this too also out to
Yeah.
everyone at the end, as well as the whole the whole community and everyone that registered that couldn't make it. So
Sure.
yeah,
Yep.
in fact I already
So go ahead with the
I
questions.
filled it out. Yeah, so there's more questions. So we've got 10 minutes.
Okay.
My denial letter, and this is another one of these, cited rectal cancer guidelines.
Yep.
I don't have colorectal. I have appendix cancer and it behaves
Appendix.
differently. How do I challenge a denial that's built on the wrong disease and the wrong,
Yeah.
So tell me,
yeah,
what I would love if there is there an opportunity for anyone to come off mute?
no,
Okay.
just me.
Because my first question is always, okay, the first appeal, or sorry, the first denial, I'm not surprised in the rare disease space
Mhm.
to hear. Okay. The first denial is just your first knowledge point that, okay, there's something different for my care than the general population. And you already know that. The question becomes, what is the conversation with your provider about what's next? If it's to pivot, were we not talking about the right care in the first place? If it's not to pivot and it is to double down, okay, can we get an external or a expedited appeal done? Are
Right.
they willing to do that?
So
Are they willing to do that peer to
that's
peer?
well, so that's when you would say, okay, this needs to be expedited, A,
Yep,
and B, we need to have an expert and
yep,
show why this doesn't make sense. And that
But they still
exactly.
throw tricks into it because right now I'm in the same situation as what you're talking about. I have a particular diagnosis. They're denying it on something completely different. They're calling my treatment code something different. They're always, and so now it becomes my physician saying, hey, listen,
Yes,
40% of the patients have to go back in and have another brain surgery.
See,
My,
Sally, it scares me because I feel like if they're still doing this to you, that I don't stand a chance.
but you do, because listen, I'm still making headway.
Yeah.
yes,
I'm still haven't gotten my final no. But the point that we keep making is it shouldn't be our burden to do all this, but it is.
but it is at this point.
Yeah, we
No,
have
and
to
it's time
know
consuming. It's so time
it
consuming.
is time consuming.
Like
And
6 hours in one day, and that was just one day. Like I've done so many hours, like I haven't
Yeah.
had to do it in a while, but I have been there, and it's really
Hmm.
or they can say have the treatment. They will pre-approve the treatment in which you here's another thing that's very important to understand. If you have a prior authorization that's approved, that does not necessarily mean they're going to pay for it. They're just saying go
Yeah.
ahead. They will throw something called a retroactive denial your way, which I am famous for getting those. They deny after the care has been received and
Completed.
taken. And this is the only genre of business that
right.
this happens to.
Yeah, oh
You
boy,
don't
yeah, that would
pay for
not be
your meal in
acceptable in my
advance.
world. No, that would not be acceptable in my world.
No, so the
Right.
retroactive denials are what they now are
On the
referring
increase.
to. Yeah. So prior authorization laws are passing. So you know what? They're always going to find something else. let's throw retroactive denials in the way and the ghost approvals, which I love that phrase now because that is a retroactive denial. They may say, oh yeah, go ahead and have it.
Approved.
And then it disappears. Nope, sorry, we're not paying for it.
Yeah.
And those bills can be horrifying. I have a patient that I am continuously working with who received a $1.75 million bill.
And
How
the one
does
thing I want to just the one thing I want to say in all of this is, do not forget that you can also you also have the right to charity care from your hospital.
absolutely.
Unfortunately, 99% of hospitals will not offer that until you ask for it.
Yes.
Yeah.
And they are actually legally bound to offer it. But that's when, all of this is up in
I mean,
legislative action and everything now.
no, but if you ask for it though, that's a whole different ballgame, right? Like,
Yes.
and
Yes,
I will say this to everyone who is listening: if you do not ask, you don't receive.
that's
Period.
right.
And the worst they can say is no.
That's
Fine,
right.
fine. I've been told a million times
Yep.
no. Like I can be told no again,
Yep.
and then I can just keep asking, and somebody, it's a numbers game, will eventually.
And please
No.
do not think that there's someone else that needs it more than you.
Right.
Yes.
Please take it.
There's always greater or lesser needs than
That's right.
us, than you. Just
What other questions are out there that we need
there,
to try
there,
to?
there are several, but we are. I'm gonna have one
We can
more.
get one more.
Yeah, I think so. We've got 4 minutes if you guys are good.
Yeah.
Sure.
Yep.
And this is a big one for this group. Genomic sequencing. Where
Mm-hmm.
they take my husband's tumor, David's tumor, and they
Tumor
sequence
profiling.
it.
Mm-hmm.
Yes, and now every 3 months he gets tested to see if that DNA is tumor DNA is running through,
Cell free. Yep.
and they're just not covering it. Like
Yeah.
fortunately, Natera, which Signatera is the test that we do, but
Yes.
Natera is the company. They have paid for it. But
Well,
That's
Matt
good.
is
That would
well
be my
versed in
first
that.
piece. I
okay.
Yeah.
come from that world. I spent about 5 years in that world. I know the CEO of Natera quite well. We worked together at Genzyme before that. But that's your first request to any
Mhm.
genomics laboratory is,
Yes.
do I have to pay this bill?
Right.
9 times out of 10, the genomics laboratories will send you 3 bills and you'll never see it again.
Well, at Natera, they didn't even send us a bill.
There you go.
They actually said, "We got you, dog." I
So,
was like,
the
I
reason
love
the
what that
reason that
company.
yeah, so the reason that is that because genomics it's not new. Let's be clear, it's not new.
Mhm.
But
Right.
in the medical world, everyone wants to consider it not standard of care because there's been no studies to include it at this point. But everyone should be having it done for your tumor with the treatment options that are now available. So because of that, every insurance company is saying, well, we're not going to pay for it. However, the labs know to get the insurance companies to pay for it, they need to have a bolus of folks that have had the testing done to show
Mhm.
benefit. So
Mhm.
that's why they're eating those costs.
Yeah, yeah. Well, I just thought because it was, from the good of their heart. But whatever. We were
Sure.
we were we were the first appendix cancer specialist, that the one that did his surgery in Maryland, didn't want to do it. They were like, this is kind of a waste of time. It doesn't usually work in appendix cancer and la la la. And I'm like, I don't care. I still want it.
That's where you have to
Yes.
advocate for
I mean,
yourself.
I had to demand it.
Yeah.
I really
Yeah,
had to demand it.
absolutely.
And then
Yeah.
I found out, just so you know, that this hospital actually threw his tumor away after 6 weeks. So we got lucky that like his tumor got sequenced and then it was just gone. Like,
Wow.
Yeah.
so we got
You
really
need that.
lucky.
That's vital information to
Yes.
have. Unfortunately,
Pathology.
90% of Medicare and Medicaid patients are not getting their tumor profiles.
Yes. Yes.
And
And you
That
need
should be
all
done.
that
what about people in
information.
community hospitals, even if they're not on Medicaid or Medicare,
They're not being offered it.
they're not
They're
being
not being offered
offered
it.
it. And so they don't even
Only
know it exists.
40%.
Yeah. I mean, the only
Yep.
reason, and so I was in Baltimore at a very large facility,
Yep.
appendix cancer specialist, and like I was told it was a waste of my time, and like I had to demand it. Like,
It's the So you have to remember your average physician, even oncologists, get about a week of genomics in med school.
Hmm.
I
They don't
know.
understand it.
I know.
So, Amanda, one of the things that I would recommend that I've done this with other organizations is if you do have a expert in appendix cancer that could help pull together some draft templates for your folks on
Yes.
if they're saying it's experimental or that it's colorectal, here's the language to utilize
Yeah.
that will ease that appeals process. And not only that, all the other physicians around the country will love you for it.
Yeah, and
Yes.
I will absolutely 100% start working on that. And I have a
If
wonderful
there's any way we can
network
help you,
of
let us know.
volunteers. Yeah, I've got a wonderful network of volunteers too that like are like happy to like just start sending things all over
Yeah.
the place.
Well, make sure you
Well,
share our emails. Make sure
please.
any of these questions, Matt and I will get together after this call and we will answer these questions that you can email out to everybody. If there are more, we'll do the same thing. But we are here to help. We are here to educate. And we could talk about this for a
Oh,
week
hours. We
about,
yeah.
about everything
Like
that's going
like
on.
I could go upstairs and get a glass of wine and then we could really get into
Yes. But
no,
there are going to
so
be more questions
well,
for
so
sure.
what I will do is I will send out the recording of this and all your contact information and as
Mhm.
well as the Q&A stuff. Kind of I like to write these things.
And the poll,
Yeah.
get
Sure.
everyone to use their voice on that poll.
Yes, I will. I will. Oh, yes, absolutely. Send me that link again because I've already filled it out.
Yep.
So,
Yeah.
but what else? I don't know.
Don't give
This
up.
is no, this has been the like so I do these things live with like doctors that, are scientists and all these things that I'm not. And so, you know, I don't really understand some of it sometimes, and I have to go and
Sure.
like learn
Sure.
about it afterwards to try to make sure I actually understand what they just told me. But with you guys, like I understand it, and like I am all in. I love it, and like I've been through it too, so like I know how to actually have these conversations,
Well,
and so
I will
thank you
say
guys, thank you so
uh,
much.
our goal with all of this, Amanda, is to get the legal risk onto the medical directors at these insurance
Yes.
companies.
Yes, absolutely. Hold them accountable.
Mhm.
Hold them accountable and do
Oh,
not give up.
look,
That
I am
it's
down with all
exhausting.
of that. So
Yes.
y'all use me too. Like come to me. I can
Will
help.
do.
I can do all kinds of things. I can make cold
I
calls
know that.
definitely to people I
That's
don't
right.
know. So there you go.
Well, thank
There's
you all
my
for your time.
superpower,
Thank you so
Sally.
much.
Yeah. Yeah, thanks everyone. Everyone have a great night and look out for all this information. Thank you guys.
Sure, thanks.
Bye. Oh God. There we are. Okay. I lost you. I was like totally involved in this whole thing. Let me stop stop recording. Oh good, I did record it. Yes.